So we are now going to treat Juliet's nose. As I mentioned before, I'm going to be using the Tearseal RHA3. And what I've done is just very roughly marked up our arteries that we need to consider. You've got your angular artery here, your lateral dorsal artery here, your lateral nasal artery here, and up here, just be aware of your supratrochlear artery. You've got your supraorbital artery here. So when we're doing the treatment, we just have to be very aware of our anatomy. Juliet's nose is a very, very tricky nose to do because she has a hooked shaped nose. And as I mentioned before, with fillers, you can't get rid of a bump, you can only disguise it. So what we don't want to do, of course, is put any filler and where the hook is, okay? So we do not want to be filling this area here at all. What we need to do is look at filling above and below so that we disguise and blend that hook. So when you're doing the nose, in this case, what we're doing is we're going to put some filler in this severe indentation here. I always lift up the skin, and I do this with a blebbing technique. So your subdermal, I've pulled back on my syringe and I've popped a little bit of filler in. Now, notice I'm keeping my fingers either side to stop any of the filler diffusing down the side of the nose. We're then going to do another little bleb. Pull back on the syringe. And I can feel the filler trying to get down the side, but it's not allowed to. Okay. Then once you've done a little section, you just give it a little push into place. And then obviously we're looking at profile. So I can check from my profile. Now that has already lifted it out. You take the camera around to the side and see if you can get like a profile shot. Yeah, okay. So now what we're gonna do, I'm just gonna pop a little bit down here because we wanna try and lift up. This is a really tricky area to do. Now remember, you've got your artery coming across here. So it's very important to always draw back on your needle. Okay, so we pop the needle in. Again, you're just under the dermis. But because the cartilage is evident and the skin is very adhered, it's quite tricky to get the filler in. So we've popped in about 1/2 ml and we're going to sit Julia up and have a look. So once you've popped that little bit of filler in, what you need to do, and it's best to stand from behind your patient, is you're literally using your fingers to mould that filler into place. Bearing in mind we want it on that part of the nose, we don't want it going down the sides. And the great thing is, of course, at this stage with fillers, it's extremely easy to manipulate. However, that does all feel really, really good. And I think we've got that all in the right place. Okay, so what I'm gonna do, I am actually gonna try and get a little bit more in the tip. I just want to see if we can just bring that tip up very, very slightly for her. Okay. Definitely don't need any more here. We're really good here. Okay, so pull back. I know I keep telling you to do that, but that's really, really vitally important. Okay, and then we check. So obviously we've put in about 1/2 syringe of filler. And I think we've got a really, really good result from Juliet. You can see from the side profile. Also, I'll show you the pictures as well. You know, we've really managed to disguise that hook. However, I am going to review her in a couple of weeks' time. Sometimes this sinks down a little bit and you just need to put a little bit more filler in. Excuse the black eye. Juliet was a training model for us the other day on another procedure. So yeah, we'll review it in a couple of weeks' time. But as you can see, no swelling, hardly any bleeding. She might get a bit of bruising, probably not, but she's good to go.